What is phenotyping in osteoarthritis? Have you ever wondered how doctors can tailor treatments specifically for individuals with osteoarthritis? One key to this personalization lies in a process called phenotyping. So, what exactly is phenotyping in osteoarthritis? Let's break it down. Phenotyping refers to classifying osteoarthritis into different subgroups based on observable traits, causes, and how the disease progresses. This classification helps us understand that osteoarthritis is not just one condition but a collection of various forms. Each form can differ in symptoms, causes, and how it responds to treatments. At its core, a phenotype in osteoarthritis includes characteristics shaped by both genetic factors and environmental influences. These influences can include things like mechanical stress on the joints or previous injuries. The features of each phenotype can be clinical, which means they relate to symptoms and physical findings. They can also be structural, referring to changes in joint tissues like cartilage or bone, or biochemical, which involves inflammatory markers or metabolic profiles. Researchers have identified several phenotypes of osteoarthritis. For instance, structural phenotypes focus on the types of changes seen in joint tissues. One example is the inflammatory phenotype, where inflammation in the joint is prominent. Another is the meniscus cartilage phenotype, where damage to the meniscus and cartilage alters how the joint functions. Then we have clinical phenotypes, which include patterns of symptoms. For example, there is a chronic pain phenotype that involves increased sensitivity to pain. There is also a metabolic syndrome phenotype associated with obesity and other metabolic factors. Lastly, there are etiologic or risk factor-based phenotypes. These consider the underlying causes of osteoarthritis, such as developmental issues or trauma. The real importance of phenotyping in osteoarthritis is its potential to guide personalized treatment. Since osteoarthritis can arise from various mechanisms, a treatment that works for one phenotype may not be effective for another. For instance, therapies aimed at reducing bone marrow lesions may help those with the subchondral bone phenotype but might not benefit others. By identifying and classifying these phenotypes, researchers and healthcare providers aim to improve diagnosis and predict how the disease will progress. This approach supports personalized osteoarthritis treatment, which focuses on optimizing outcomes by considering the unique features of each patient's condition. In essence, phenotyping in osteoarthritis is about understanding the different subtypes of the disease. This understanding helps in developing targeted treatments that can improve long-term management and quality of life for individuals living with osteoarthritis.